Okay, so this is a brain surgeon who is talking about brain supplements that he is having with supposedly evidence. Let's take a look.
Do you know this neurosurgeon takes brain supplements to protect his precious brain? Listen in. I am Dr. Arun Naik, neurosurgeon for 25 years now. Being a neurosurgeon, I handle people's brain daily. I have studied the brain physiology for 25 years now. I'll give you my trade secrets of brain health supplements. Number one, magnesium. It's so very important for more than 600 metabolic functions every second, crucial for neurotransmitter functioning of the brain. 25% of population is deficient. It regulates mood, assists digestion, regulates sleep, and delays dementia. Deficiency is known to cause Alzheimer's disease. I take magnesium glycinate at night. Number 2, creatine. Most studied but most feared supplement till date. Very safe, super effective for brain energy. It releases ATP, brain's energy particles, aids my muscle recovery, and is shown to improve cognition as we age. I take 5 grams with my smoothie. Number 3, omega 3 fish oils. Half of our brain fat is made up of DHA, which is the building block of neural cells. Super effective to fight cognitive decline. I take 2 grams of fish oil per day, giving about 600 mg of DHA. Number 4, multivitamins. Vitamin B complex, including biotin, vitamin A, E, etc. B12 I take is methylcobalamin. Number 5, vitamin D. Half of humanity is deficient, including me. I take 60,000 units every month and my levels are satisfactory. Disclaimer, I am 55 and I am very, very active. 10,000 steps every day. 6 days a week I do resistance training. I have no illness. Non-smoker. I'm a doctor and I know what my body and brain need. This list is only for information, and consult your physician before starting any of these supplements. Share this and come back.
Okay, so that was a lot of rubbish which I think we'll need to discuss in detail. So let's go. Okay, so welcome to another episode of When Doctors Mislead. In this episode, we are dealing with Dr. Arun L Naik. He is a neurosurgeon, I think in Bangalore, and he talks about brain supplements which he is taking, which he feels is improving his overall health and brain function, etc. So, this is basically a lot of discussion in the sense that you'll enjoy this because we will go into these supplements in detail with regards to brain health and see if his use of supplements is rational, logical, and if you really need to actually use these supplements, to improve your brain health. Because, a brain surgeon is talking about brain supplements, so should be true, right? Not really. So he starts the video with, saying that I'm a brain surgeon in handling brains and I have studied the brain physiology for 25 years. I mean, come on, you're a neurosurgeon, so we all know that you have been studying the brain quite a bit and you're doing good work in the field of brain surgery. So this is something known as appeal to authority. So, for people who have no actual credibility or expertise to talk about some topic, before they talk about that topic, to make the audience feel at comfort or to make the audience feel that an expert is speaking, they actually talk about themselves from a position of authority. So this is known as appeal to authority, where insisting that a claim is true. In this video, it's about brain supplements. Insisting that a claim is true simply because a valid authority or expert on the issue said it was true. So it's a brain surgeon talking about brain supplements, so should be true, right? Also, without any supporting evidence offered. So he did show some papers in between, but you can actually see that most of those were narrative reviews and not realistic actual meta-analysis or higher levels of evidence that I'm going to show you. So basically, what he did was, it was just smoke and mirrors, completely, uh, you know, clean bowled you with all that, neurosurgeon, brain surgeon handling brain stuff, and then directly went into these brain supplements without actually offering good evidence to support his claims. Now there is another uh, logical fallacies. So these are all logical fallacies that people commit to mislead other people, to mislead the audience per se. So the next logical fallacy that I think could be applied here is something known as argument from false authority. So, when a person making a claim is presented as an expert who should be trusted when his or her expertise is not in the area of what has been discussed. So, basically, he's a brain surgeon. So, I would rather he talks about treatment of strokes or prevention of stroke, or surgical management of certain brain disorders, or surgical management of complex brain diseases, or post brain surgery or post brain disease recovery, and what helps in all of that stuff. So that is his routine, and he should be talking about that. But instead, he chose to talk about brain supplements, which is something to do with diet and nutrition. And as a surgeon, I'm not sure if he's really, I mean, he studied brain physiology, but I'm not sure if he's actually studied nutrition and dietary management of brain disorders from preventive and therapeutic aspects. Because from what I gathered from all the evidences, a lot of things that he said was totally misleading, and I think he's consuming a lot of supplements which he does not need. And I mean, I'm not sure if he's going to see this video, but if he does, he should stop all that and save himself a lot of money, and also a lot of side effects, which we'll come to very soon. So his first supplement was magnesium. Wow, this is one of the most interesting and hot topic supplements on Instagram. I have not seen magnesium move so much in other social media, but definitely on Instagram, this is a hot topic. So he said that magnesium has more than 600 metabolic functions, but the National Institute of Health fact sheet on magnesium says that it is a cofactor in more than 300 enzyme systems that regulates biochemical reactions in the body, including protein synthesis, muscle and nerve function, blood glucose control, and blood pressure regulation. He says he even mentioned digestive system, which is not true. It doesn't affect the digestive system. These are the systems that it affects, and it's about 3,000 enzyme systems. So it's not 600 metabolic functions. So that was misleading. That makes you feel that magnesium is so important for you and you need to take these supplements as soon as possible. But that's not the way to do it. So he said that 25% of the population is deficient. That means 25% of Indian population, because we are an Indian is talking about the Indian population. 25% of the population is deficient is his claim of magnesium deficiency. But if you look at the papers, you can see that about 48 to 60% of adults do not achieve the average recommended dietary intake of magnesium. And this is global data. It's not specific to India. This is global data. And about 15 to 42% of apparently healthy adults have been shown to have magnesium deficiency. So that's about 15 to 42% of healthy individuals across the globe, across the world. It's not purely 25% of Indians. I don't know where he got the number from, but that's actually misleading. And very importantly, there is some data on India, and this is mostly to do with pregnant women. So, pregnancy is a condition which is most commonly associated with magnesium deficiency. So, you can see that magnesium deficiency was identified. I mean, very low levels of magnesium was identified in pregnant women in India, that is 43.6%, and Sudan, which was 57.2%. So, this is the high risk group where there is magnesium deficiency. Now, it's very important to realize that the magnesium that we measure in the blood is not its true value, because assessing magnesium levels presents a challenge. The predominant source of magnesium is actually soft tissues and bones, soft tissues, muscles, etc., and bones. And we are only checking what is in the blood, that is serum magnesium. The blood only accounts for about 0.8% of all magnesium in the body, and 0.3% of that is in the serum, and 0.5% of that is in the red blood cells. So you can imagine that we are actually not measuring realistic magnesium in the blood. So when you say that somebody is deficient just based on the blood report, it's actually not quite true. But that is what we have at best, and this is what we measure. Now, I want you to focus on this last part. Although the majority of adults will not experience serious consequences, which means that an apparently healthy adult whose magnesium levels are low, they will not have any symptoms at all. Subclinical magnesium deficiency may have profound effect on individuals in high risk groups. So if somebody has low magnesium level, for that person to actually have some magnesium deficiency related issues, symptoms or signs or diseases, it has to be in a high risk group. For example, pregnant women and women undergoing menopause. I mean, so basically, a healthy adult like him who's running 10,000, making 10,000 steps a day, doing weight training and all, I'm not sure why he's taking magnesium in the first place. So basically, it was irrational use of magnesium in him. But let me come to this more. We will talk about magnesium in detail. So there is this study. So he's basically talking about brain disorders and magnesium. So let's focus on that. So he said that magnesium deficiency causes Alzheimer's. So scary, right? I mean, what if I am magnesium deficient now? I don't know, and maybe I'll develop Alzheimer's later. So this is a scary proposition. But look at what the data says. Serum magnesium is associated with risk of dementia. Yes, that is true. But the conclusion of the study says that it's published in Neurology, one of the topmost journals in neurology. Both low and high serum magnesium levels are associated with increased risk of all-cause dementia. Come on. It's not just low magnesium, but if you're consuming magnesium and if it goes above your recommended limits or recommended levels in the blood, it can also cause increased risk of dementia. So this is just crazy that he's just asking people. I mean, he says that he's just giving out information, but nobody's going to go visit a doctor and ask about magnesium supplements. Nobody's going to pay a doctor just to ask about magnesium supplements. They're just going to buy magnesium supplements on the internet and consume it because this fellow is consuming it. And this is just totally wrong from his part to do this, because even high magnesium levels are associated with high risk of dementia. Now let's see more on this. So he says it causes Alzheimer's, right? So there is a causal effect. But what does the papers actually say? So this is from a large meta-analysis study, which says that the results of this meta-analysis study indicate that magnesium deficiency may be a risk factor for Alzheimer's disease, and magnesium supplementation may be a potential valuable adjunctive treatment. So he's making this classical mistake here of correlation does not imply causation. So we have summers coming in. Summers will cause increase in ice cream consumption. It will also cause increase in sunburns, right? But can you say that increase in ice cream consumption causes sunburns? You cannot. It's just a correlation. Same here. So all of the studies point towards magnesium may be a risk factor for development of Alzheimer's or other dementias. That is low magnesium, even high magnesium also. But it is not a causation. So his understanding of Alzheimer's disease and magnesium is quite wrong here. I mean, I'm a liver doctor, not a brain doctor, but still, I can just look at the data and see that what he's saying is not true. Now, if you look at magnesium's value in cognitive health in adults, this is another systematic review and meta-analysis, highest level of evidence. It's very clear here. Look at these colored, I mean highlighted areas. It says that evidence from the limited number of RCTs was insufficient to draw conclusions on the effect of magnesium supplements on cognition. So cohort studies showed inconsistent dose-response relationship between dietary magnesium and cognitive disorders with high heterogeneity across populations. So basically, these studies were so different and variable and varied across different populations across the world. No conclusion on magnesium and cognition could be actually made out from these studies. And there is something very important here. There is a U-shape association. So U-shape is, the graph will go like this, which means that there is a particular cutoff where magnesium may be helpful, but if it goes below that, magnesium is not beneficial. If it goes above that, magnesium is not beneficial, the levels of magnesium. So it means that lower levels of magnesium can actually harm, or higher levels of magnesium can also harm. So this is important because blind supplementation like that, how this fellow is doing, I don't think that actually helps. It may actually cause more trouble in the future. So more evidence from RCTs and cohorts is warranted, is what this study mentioned. So there is no actual evidence for you to take magnesium supplement to reduce your cognitive decline or prevent Alzheimer's disease or dementia, etc. So this is something that we need to think about before you do this. Now, another important paper. This is the next paper. Yeah. So this paper is on magnesium and sleep. So I just put the sleep part here, even though he did not mention it. I just put it here because people will have this question. So what is the relationship between magnesium supplementation and sleep? You can actually see that a lot of people personally talk about how their sleep improved after consuming magnesium, but there is no actual evidence for this. So if you look at this 2021 meta-analysis paper, it concludes like this. This review confirms that the quality of literature is substandard for physicians to make well informed recommendations on usage of oral magnesium for older adults with insomnia. So this study basically looked at all the studies in older adults where they had sleep disturbance or insomnia, couldn't sleep properly, and they looked at how magnesium supplementation helped them. But the evidence for that was so substandard that this recommendation could not be made. Now, if you look at a more recent paper on role of magnesium in sleep health, this is very interesting. So, observational studies suggested an association between magnesium status and sleep quality. But when that was looked in RCTs, which is like gold standard of looking at treatment and effect. So when magnesium supplementation were looked in RCTs, they reported contradictory findings. So when you looked at observational studies, retrospective studies, cohort studies, etc., a lot of these studies had high risk of bias, a lot of different types of magnesium supplementations used, different populations, different age, gender, etc. So even then, that those observational studies said that magnesium supplementation helps in sleeping, our sleep parameters. But when it was put in actual trial in an RCT, the RCTs were totally different. So this is very important. So what you observe may not be what is actually true. So almost all the randomized clinical trials showed an uncertain association between magnesium supplementation and sleep disorders. So there is no actual data for us to suggest or recommend that take magnesium supplementation for your sleep. I mean, who benefits from this? What part of the sleep gets benefited? What type of sleep disorder gets benefited? We have no idea. But then, I think this particular supplement gets sold like crazy over the counter, and I think people are just unnecessarily consuming magnesium supplements, and I think this is going to cause problems in the future. For example, there is a high risk of dementia disorders with high levels of magnesium. Also, please remember this. I provide magnesium supplementation to my patients. I mean, they are advanced cirrhosis patients, and for them, I give magnesium supplementation for cramping, even though the evidence is very low, and people want to try it out. So I give them for a month, and it doesn't work out. We stop it. Also, magnesium supplementation is given in pregnant women with high blood pressure. It controls blood pressure in pregnant women because of magnesium deficiency. So it's actually recommended in that particular condition. Otherwise, I don't think there is any use for this supplement. But it's the supplement industry, so people just keep falling for their nonsense promotions. So again, there is another paper which speaks about magnesium and sleep, and this is a recent paper, and you can actually see that the evidence supporting magnesium's effect on sleep onset latency was limited by the significant risk of bias, particularly because of heterogeneity in study designs and methodologies and lack of control for confounding factors such as age, gender, and magnesium intake. So basically, all the studies that talk about magnesium and sleep, if you pull them all together, you can actually see that most of these studies are highly biased, and there is no actual recommendation for you to consume magnesium to improve your sleep. I mean, I am sure that you have your experiences, but experiences are not scientific evidence. So please don't talk about your experience. That doesn't mean anything. You cannot generalize personal experiences, but you can generalize scientific data. It's for all of us. Science is universal, scientific studies are universal, scientific findings are universal. So there's no point in saying I benefited from this, so magnesium is good. It doesn't make any sense actually. Now, next one, creatine. So creatine, yes, I agree to some extent that there is some good stuff happening here, but let us look at from cognitive function point of view, which he was talking about. So this is a systematic review and meta-analysis of creatine supplementation on cognitive function in adults. Let's see what happens. No significant improvements were found on overall cognitive function. I mean, the brain surgeons say so, so it should be correct, right? Not so. This is why I tell people, my followers, my friends, I tell them that it's just because someone is telling you that something is beneficial, something is useful, and it doesn't work out that way. You have to critically think on it, or get someone to actually talk about it from an expert or an evidence point of view. It's not because I said something about the liver, and this is something beneficial for the liver, without showing any actual evidence, or without convincing you about the evidence that I have to make that claim. I mean, you should not believe me also. Similarly, just because a brain surgeon said that you can take brain supplements, you should not take brain supplements. It's just nonsense. And this particular study also says that creatine supplementation was more beneficial in individuals with diseases. Please remember this. That fellow is say he himself says that he has no illness. He's working out every day, jumping, playing sports, and doing a lot of activities. And he's consuming creatine. I don't know for what, but I'll come to that also. So it is beneficial for individuals with diseases and those aged 18 to 60 years, and mostly females. Now, if you look at that particular statement that I just made previously about how creatine is useful in certain diseases, this is what is important. So there has been a lot of studies in people with mental health disorders, especially depression, where they have shown that, even recently also they shown that addition of creatine supplements improves depressive symptoms. So along with standard of care, it's not just creatine, it's standard of care with creatine, and that actually improves depressive symptoms. So this is a disease group that is improving, that is getting benefited with creatine supplementation. Okay, next we move on to where creatine is beneficial. So if you look at the recommendations on creatine supplementation, it is mostly recommended in people who are performing athletes, athletes, bodybuilders who require good muscle recovery, who require energy levels, who require enhanced post exercise recovery, etc. They are the ones who actually use creatine. So creatine is basically something that is specifically for high performance athletes, bodybuilders, and such highly active people, not somebody who's healthy, and that too not to prevent cognitive decline at all. So if you look at these updates and guidelines on creatine supplementation, you can actually see that enhanced post-exercise recovery, injury prevention, rehabilitation, uh, short duration, high intensity exercise. I mean, these are the conditions where creatine supplementation actually helps, and this is where it is usually promoted or recommended, but not otherwise. So even if you look at these sports nutrition guidelines, they talk about creatine supplementation, dose response, who should take, how much to take, how long to take, etc. But if you look at from cognition point of view, like this particular brain surgeon was taking, it's very clearly mentioned in this particular study that creatine supplementation research fails to support the theoretical basis for an effect on cognition. Come on. So if you are a performance athlete, if you are a bodybuilder, please, yes, of course, creatine does help you. If you have mental health disorders, there is no recommendation to start creatine. Please speak with your psychiatrist about this, because the studies are only just coming up and we need more and more data to make it part of the routine treatment guidelines. But when it comes to cognition and brain health, creatine actually does not help in healthy adults. So there is no evidence to supplement creatine in healthy adults to prevent a disease or to improve your brain function. This is completely wrong, and he's wasting his money. That's all I can say. Okay, next, omega fish oils. So again, this, I mean, omega fish oils has a lot of uh, benefits in various situations, various conditions, but I'm going to focus on dementia and cognitive functions, like, because he spoke about that. So let's just stick to this. So if you look at this particular study, in the study they have mentioned that uh, in the randomized controlled trials on omega 3 fatty acid supplementation for cognition, these authors have mentioned that only when people have diagnosed mild cognitive impairment, they will have some benefit, and the effect is very small. The effect size is very small. They'll have some benefit with omega 3 supplementation. But in healthy adults and patients who have Alzheimer's disease, omega 3 fish oils do not help. And that is what the second study shows here. So you can see the orange highlight here. Supplementation of omega 3 fatty acids may confer potential benefits to executive function among the middle aged and elderly demographic, particularly in individuals whose dietary omega 3 level is not substantially diminished. So basically, if you look at omega 3 supplementation, it's mostly in a small subset of people with already cognitive impairment, that it can actually prevent little bit of cognitive decline in those people, but not in healthy adults, and definitely not in somebody who's very active as this brain surgeon. So if you look at this particular paper again, it shows that patients with early memory complaints or a family history of dementia, or those with cognitive impairment, should be counseled on potential benefits of fish intake and supplementation with omega 3. So if they're consuming fish, seafood, etc., or dietary sources of omega 3 fatty acid rich sources in the diet, They don't need supplementation. Those who don't consume such, you supplement. And also, very importantly, in healthy people, those with this particular gene carrier, those who are this particular genetic carriers, that is apolipoprotein E4 carriers, they will benefit from supplementation prior to development of cognitive decline. So if you have this particular carrier state, you may benefit from omega-3 supplementation, but this is not recommended. So I mean, you can't just go in and check for these genetic carriers. It's these are expensive tests. These are not recommended to be routinely done, etc. So we don't have any actual data to support this. But then please know that this is what the data says. You should not just consume omega-3 thinking that your brain function is going to get better, or your cognitive decline is not going to happen, etc. It doesn't work that way. Now this late recent, I mean, it's not recent. This has been known since decades. For example, this 2012 paper also says the same thing, that the results suggest that the effect of omega-3 fatty acid supplementation within specific cognitive domains in patients with cognitive decline, but not in healthy or Alzheimer's disease subjects. So please see that healthy people do not require omega-3 fish oils. It's a waste of your money. And omega-3 fish oils are not that safe. 2 to 4 grams can cause heart rhythm and rate abnormalities, something known as arrhythmias. And this is well proven. The higher the dose you take, the longer the duration of the intake, you can actually get heart rate abnormalities and arrhythmias, etc., with omega-3 fatty acids. So it's not like a very safe supplement. It's quite dangerous at some point for people who already have cardiac risk factors. Multivitamins. I think this was the worst advice he has given in the whole video. So I don't know why he's taking multivitamins in the first place, because you can see the data. So this paper that has come out in JAMA last year shows that for healthy adults, taking multivitamins daily is not associated with a lower risk of death. So all cause mortality, that is death, and all cause organ related issues did not improve with multivitamin intake, and definitely no brain function improvement at all. Now, there are some studies which says that multivitamin intake in elderly people at risk of cognitive decline could help reduce the progression of cognitive decline. But that is also a small study. None of these clinical societies recommend people take multivitamin to prevent cognitive decline. Does not happen that way. He is recommending because he feels it's helping him. That is not scientific data. But most importantly, please look at this, bottom paragraphs that they have, where I have marked. So in this yellow part, you can actually see that even after using multivitamins and multivitamins daily for at least 10 years, women had the same risk of breast cancer as the non-users. So it did not reduce breast cancers. But one study in a meta-analysis found that 19% higher risk of breast cancer. I mean, if you take multivitamins, in some women, the risk of breast cancer can actually increase. And this is not good news. Now, look at the other part. Men who took daily multivitamin had a 2% higher overall risk of cancer, including 3% higher risk of prostate cancer, 8% higher risk of lung cancer, 16% higher risk of leukemia. Come on. And this fellow is telling people to take multivitamins. I mean, he says it's just information sake and all, but come on, this is just absolute nonsense. This is dangerous misinformation. It's not even benign. It's quite dangerous. So please don't take multivitamins unnecessarily if you're a healthy person. And among women, taking a daily multivitamin did not affect their overall risk of developing cancer, except for oropharyngeal cancer, that is cancer of the mouth and throat, which increased by 46%. So women have a high risk of developing cancers of the mouth and throat if they take a daily multivitamin, and that too for longer duration. So please don't think that multivitamins are just benign things that are not going to harm you. It can actually harm you quite badly, and in the form of cancers. And I think this is just rubbish advice that this person is giving here. So no multivitamins for you if you are healthy. Good food, your dietary nutrition requirement should come from food and not from these supplements. Okay, vitamin D. I have already spoken about this, but let me just very clearly convince you why you do not need to check for vitamin D in the first place, deficiency, and then why you don't need to take vitamin D. So he says he takes vitamin D every month, and which is 60,000 units. So there is so many things wrong with this, so much of nonsensical misinformation that he's spreading through this video. So let's look at this latest data. So this is the new guidelines for vitamin D prescription by the Endocrine Society. Look at this. Only four groups benefit from vitamin D supplementation. So this particular society guidelines states that in these four groups, you don't need to check for vitamin D levels. Just give vitamin D. Just supplement vitamin D. You don't need to check for it. That is what they have mentioned. There is known as empirical vitamin D supplementation. So the first group, children aged 1 to 18 years, to prevent rickets and to potentially lower the risk of respiratory tract infection. So child between 1 and 18 years, you can give vitamin D without even checking the levels. Second, pregnant people, to lower the risk of maternal and fetal or neonatal complications. So in pregnancy, you can give vitamin D supplementation to lower the risk of baby and mother related you know diseases and disorders and death. So even pregnant women can go ahead with uh, supplementation without even checking. Now the third is adults older than 75 years, to lower the risk of mortality. So any adult who's above the age of 75 years, please supplement vitamin D, and that helps reduce the risk of death, all cause death, in this group. Now fourth is adults with pre-diabetes. So somebody who has an adult who has a HbA1c level between 5.7 to 6.4, pre-diabetes range, just supplement vitamin D to them so that the risk of progression to type 2 diabetes is reduced. So these four groups, you can just give vitamin D supplementation directly without even checking. Now, the other groups, which means that people who are between 18 years to 75 years who are not pregnant, you don't need to even check vitamin D levels and supplement. And in these groups, the supplementation protocol is also different. So they have mentioned is that the recommendation is for daily rather than intermittent empiric vitamin D supplementation of more than what was recommended in the previous guidelines. So about 600 to 800 units per day is what is required. And this monthly and weekly kind of high dose supplementation is now not accepted. This, I don't know which year he's living in. These are latest guidelines, and I think he should be updated about this instead of wasting his money on 60,000 units of vitamin D every month. It doesn't work that way. The guidelines actually says don't give like this. Give it daily and only in these four groups. Otherwise, don't have to even check for vitamin D deficiency. Nothing's going to happen to you. Don't waste your money on checking vitamin D and supplementing vitamin D. So out of after all this, he says that this is just a disclaimer and you have to talk to a physician. So I was wondering, why did he not talk to his physician? I think he should have actually consulted his physician before he started all the supplements and made this video, because this video is, I think, it's just total rubbish when it comes to brain supplements. None of these actually work for the brain in any way. We saw the evidence. So to conclude my session, I'll just put this here and let you know that never confuse education with intelligence. You can have a PhD and still be an idiot. This is by Richard P. Feynman. I think this beautifully works in this context that we are talking about. So until next time, I hope you understood the importance of what supplements are. I mean, what we have discussed and why it may not be actually beneficial for you. Just because a brain surgeon said it's beneficial, it may not be really beneficial for you. We need to look into the data, and I hope the data I have shown you convinces you otherwise, gives you more confidence about the supplements. If you have any questions or queries, please put the questions in the comment box, and probably if you have more doubts or queries on other supplements, I'll be happy to take this up in another video. And be safe and stay safe. Thank you.